Well,
I'd like
Wave
to-
your hand.
like to call this meeting to order if I could. My name's Woody Eddins. I'm chairing the meeting tonight, and may we stand for our Pledge of Allegiance. I pledge allegiance
to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
I believe everybody sitting around the table is a member of the committee. Don't ask me to name everybody's name, but I don't see any public audience here. Did everyone get a chance to look at the minutes of the last meetings, September 10th, September 22nd meetings? And now I know there's been a change. Do we still need a motion to approve these minutes or to accept
If there are
them?
no changes, the minutes stand.
The minutes stand, so unless there are changes, then they will be as is.
I had a question. I thought we had some people who spoke in public audience last time, but the minutes say no one spoke in public audience. I thought there were some parents in those chairs in the back who talked about their own, one of them talked about an experience with a child who had used heroin, and there were a couple of other personal expressions.
You are absolutely right. We did have, I remember that. We did have those people here last time.
So the minutes should say several people expressed, I mean, I don't think we need to say what they said, but several people described their experiences with young people and drug problems or something like that.
Okay.
So we need a motion to amend the minutes.
Yes, I believe we'd,
You state
you
your
consider
name
that a
when you
motion to
do it.
I
amend?
will make a motion to amend the minutes
No, wait.
to say, but I just
Can you
said.
state your name when you do make the motion?
Yes, I'm Sally Rieger, R-I-E-G-E-R.
G-E-R.
I'll
And
second.
you're making the motion?
Yes, I made a motion. It's radical.
Do you need that written up, or,
I'm going to get a copy.
Okay.
Shall I get a copy? But for the meantime, if you can just say who you are so I can record it.
okay.
Yeah, but you wrote with the comments she just made.
I did make the
Yeah.
comment.
Okay,
Several
as long as you
sessions-
have what the motion states.
Yeah.
Yes, that several persons described experiences with young people and drugs in the public audience.
Okay.
Good?
Yeah, that sounds good. And all in, do we have a second on that?
Yep, Vicki?
Okay. All in favor, say aye.
Aye.
Opposed? Motion carries. Have some updates, and I'd like to call on Lisa, if I could, if she would say a few words and give an introduction for us.
Well, good evening, everyone. I think you all know what this committee means to me. It took a long time to get started, and I value it very much. Life changed, got a little different for me. And so I'm stepping into a new role, but in that capacity, this committee, I think everybody here knows, will have my full and complete support, and I'll do whatever you guys need, because I view what you are doing as so important. I wanted to let you know that tonight, Chris Kelly will be joining Pastor Woody as co-chair. Chris comes from the Board of Education most recently. He was the vice chairman there, and he has also served on the Board of Selectmen, and in that capacity, he was chairman of Public Safety and of Personnel Subcommittee. So he comes just with a tremendous wealth of public service experience. I have had the privilege of working with him on many issues, and he is substantive, he's kind, he's analytic, and I can't think of a better person to join you. And so I'm thrilled that he's willing to take this on, and I hope you'll join me in welcoming Chris Kelly to this committee. Does anyone have any questions for me about anything? No, I just want to say I think there's some great things coming down the line. We're going to be looking at the website that Steph started working on. We had the website subcommittee looked at some of the, gave some suggestions. It is a very rough draft, and so they're open for changes. Steph, right now it's housed in a position. It will look a little different once it's live. So I just wanted to say that. And any resources this committee needs, please know that you have my full support.
Thank you, Lisa. Any other items for updating the committee?
Pastor, would I regretfully share that I can't find the name tags? That's why I was late, running frantic. Fred was, looking at the highest of places, and I can't locate them. So I do apologize to everyone.
Oh, I have one update. I forgot.
Okay.
I think since we last met, I was interviewed by Dominique Avery along with Heather Madano and Captain Bolter from the police department. And Heather, I don't know if you guys have had a chance to see it. We'll try and get you the link. Gave just a phenomenal testimony to her family and how they dealt with addiction and love and support. And I thought the police officer did a great job explaining how the community supported you and how you felt supported. So it's worth watching. It's very powerful. And I wanted to thank Heather for doing that. It took a lot of courage, and we appreciate it.
Really do thank you for that, because it means so much to other people who are going through it to know that they're not alone.
I haven't watched it.
I haven't either. I know. The two of us can't watch it, but you guys watch it. Yeah. But she was wonderful, and it was very powerful, and I hope it will change people's lives, because that you were willing to talk about it. It was phenomenal.
Now, to watch that, do we have to wait till it's scheduled and comes on, or can we click it on the website?
Well, I was going to add it. I didn't do it yet, but I was.
It's on the website.
And I was going to add it here.
It'll be added to
This
this.
page.
Okay, good. No more updates. The next thing, we had legislative updates, and John Hampton, I had thought was going to be here.
He had said he was, so
We
maybe
will-
he's running late.
He will come in late, and
The same traffic jam I was.
Oh, really?
so we'll move on.
Or texting, right? Yeah, no. No, that's it.
Cheryl, did you have any updates? The other day, I know you mentioned that you had been to the Capitol or something. Was there updates from that?
Well, I thought Representative Hampton might discuss this, but tomorrow is actually Family Hearing Day at the Capitol, and I don't know, I know some of you are involved peripherally, and persons with disabilities who might need group home services or interested in how the waiting list is progressing and funds available for that. And they are going to have Family Hearing Day tomorrow from 11 to 1 at the State Capitol. So if you're interested in speaking on any of that and services that might be available to families in home and in a residential setting, it's a good time to let your legislators know what you need and what direction you think they should go in.
Thank you. If John comes, we'll put him back in.
I'm sure I thought he might speak to that.
Pastor Woody, if I may, I also want to give an update on some speakers, and I am going to defer to both Mark and Neil to speak about the program that happened last week at the high school, and then have Brian speak about the program that's going to be upcoming at the middle school. And then when they're done with that, want to just share with you some ideas around future speakers this spring.
Thank you.
One of the things that we've done for the past couple of years, it actually started out of a initiative at the high school where we were looking at student stress, and started around like academic issues, but really expanded beyond that, looking at somewhat homework loads and the type of pressure that kids are under, but out of that came up with a number of recommendations of things that we should do at the high school, some of which involved trying to monitor some of our activities, trying to put some guidelines around homework. But one of the things that we really felt was a growth area for us was kind of educating parents about, and not necessarily about issues of drugs and alcohol, but really just around the challenges of parenting adolescents in kind of 21st century America, and especially a suburb like ours. So partnered with Mark and his partners a couple of years ago, so for the third year now, and we time it to be, we advertise our program to be like a start, good New Year's resolution, good habits start in the new year, come learn something and talk with other parents about some of the themes that I'll let Mark touch upon what he and his counseling partners talk about. But we get a pretty good crowd. We had 70 parents there last week. That we've had maybe a little very cold last Thursday. So we maybe had a little more than that, but we've had a pretty consistent crowd for 3 years now. We do it in the amphitheater at the high school. And what I liked about last week's session is that our presenters made it very interactive and got the parents in the crowd really talking, so that it really felt very supportive. So they could tell you a little bit about the program that they put out.
Sure. So some of you know me, some of you don't. My name's Mark Lehman. I'm a family therapist from West Hartford, and as Neil mentioned, I'm a partner in Family Resource Development Center, which is a counseling center. We have 2 offices, a satellite here in the center of town, and our main office in West Hartford. And myself, Jeff Genzer, and Dan Weiner presented last week at the high school on a number of things, but we really put an emphasis into motivation and how families are able to motivate their kids to get their work done and kind of juggle life as a high schooler. And it was interesting, we had a number of emails come to us ahead of time from the presentation. And we had sort of the whole gamut of how do we, motivate our child who, won't do anything but play Xbox, to how do we, help our child kind of kick it into a lower gear because they're doing 12 hours of homework a night. So it was interesting, as Neil said, it was interesting to have a lot of the interaction with the families and really just get a sense from them as to some of the struggles they have, offer some solutions and some ideas for them, and really just give an emphasis to them about, relying on each other more and getting a sense that what's going on in their house is probably going on in many other houses. And developmentally, some of it's, totally typical and some of it's not. And what are the resources that are out there, whether it's counselors or other ones, within the school or even outside in the community that they can rely on when they are having difficulties. So this coming week we have another presentation I'll be doing at the junior high school with Brian and his staff. And it's really a very similar presentation, just geared more developmentally to 7th and 8th graders. And each year we've done that. We really try to talk a little bit about what's to come and really get families, give them an understanding of what are some things they can be doing now to prepare for some of the onslaught of stressors that come with being in high school. And really just, giving families an understanding that it's not just Simsbury, it's many other towns that we deal with, but there's some themes that we see and some things they ought to be knowing, ahead of time. So that's coming next week.
Mark, do you tape that? Is that taped by SCTV?
Great question. Last week's was not. So,
But you
we
tape
haven't-
the one? Because we could put that on the Community for Care website.
That's a really good question. Yeah, I'd have to look into how, but yeah, I'm sure we probably could. Yeah. Last year's at the junior high school was very interesting in that it was on the heels of, Brian, what's the meeting that?
Well, sort of the social, our PTC.
PTC, yeah.
Yeah.
So there was already a number of parents there, and I found last year's discussion to be also very interactive. Parents really want to try to get a sense from other, families that come, what are some of the struggles they're having and what's worked, what's helped them. So we'll look into seeing if we can
May
set
not
up-
be something parents are comfortable with, but
Well-
just to think about.
or just to film us and maybe leave
Yeah.
them out of it or something. Sure.
So that'll be next Tuesday, the 20th at 7 p.m. So that's a program that's sponsored by our PTC. We're glad Mark's coming back this year, sort of backed by popular demand. The program was really well received last year. And last year, what sort of initiated us reaching out to Mark was concerns around social media specifically. And to just borrow some of Neil's remarks, sort of parenting adolescents in the 21st century. And so that was sort of thematic for us last year. We had a parent series that we offered our parents. This year, again, bringing Mark back to address a lot of those same themes and concerns. And so we're glad to have him.
And you get a good turnout for that?
We do. I would say last year probably between 40 and maybe even closer to 50. We have essentially a space that's the size of 2 classrooms that we open up to one large space, and we filled it. And so it was very well received, and we're anticipating a good turnout this year as well.
I think it's also just one other thing. I think it's helpful for families to tie outside resources to in school resources. There's wonderful staff at both schools, and I find some families really know about it, some families don't. But it really gives an opportunity, certainly at the high school, we're doing questions and answers, and the guidance department was involved. So, I think that's, certainly we work together, but I hope that, through that, families also work with them as well, so.
One of the things that we did talk about, because we always talk about resources, right? And when we, with the cooperation of this whole group, this parents guide, I think it was very well received, that this was kind of like a push notification, that here it is, you can certainly take it if you want, it's good for future reference, they may have learned some things that I wasn't aware of. And I think that that's one of the goals and objectives of this group, is to share what those resources are. Because typically people don't want to necessarily seek those out because of judgment or confidentiality or other issues, but I think as a group, we are charged with sharing what some of those resources are. So at some point, Mark and I were talking about doing some push notification around mental health resources for, from kids to, our elderly in the community, and what do those look like. And I still think we should certainly focus on that, because people just don't know what the resources are out there.
Yeah.
So that's something that we can continue to look at. So we have the great program that did happen at the high school, one that's coming up certainly at the middle school next week. In April, on April 9th, it's going to be held in the Simsbury High School amphitheater with the support and collaboration with the Simsbury Police Department, as well as Mickey LaCursbeck and Social Services. We have Tall Cop coming. He is just that, a very tall cop with an incredible experience to speak with students and to speak with parents. He'll be doing a student focus discussion with high school students during the day. We're going to work with Amy Muska, the department supervisor for physical education and health, to make sure that that happens at the high school. And then in the evening, we'll be offering a parent component to come. So certainly we'll be advertising that. In the interim, some of us have met since our last meeting. Mark was certainly a part of that. Cheryl, Todd Cushman, one of our SROs, to possibly look at a community presentation of panel with very similar threads to what Neil and Brian discussed here about being a teenager is hard, and how do we support that, and how do we all come together as a community, and really looking at a variety of different perspectives, coaches, police, counseling, teachers, maybe some previous students, to talk about experiences and perspective, and again, to come together and what are the safety nets that we provide our adolescents proactively, that we can provide proactively here in Simsbury. So certainly more to come on that, probably a March timeline we're thinking. And one other is a potential speaker is that we have been offered, Helen Donaher, our Director of Special Services here in the Simsbury Public Schools, has been in contact with the Institute of Living, and they are very willing to come out to do a program either for us as the community for care or the larger Simsbury community around mental health issues. So another potential that we're certainly working on for the spring months. So again, if anyone is interested in working on those efforts, please see me, please see Mark, and we'll make sure that that happens.
Yes. Do we need to put together a committee now that would be interested in looking at that?
We do have one started, but what I can also do is, why don't I send around another sheet of paper and make sure that we have anybody who might be further interested in helping with that and those endeavors.
I think having that person come speak to this committee would be great. If they want to do it in a larger format, that would be fine as well. But we are already set up here.
Well, maybe we could look at that for our next meeting. Although I do want to point out a potential conflict. As I looked at that date of April 8th, I believe that there's a public hearing on Capitol that night. So that might be conflicting, so we may have to look at a different change in April.
Okay.
Okay? So that's just something that was brought to my attention recently.
Sorry.
Is that something that would be good to also have SCTV record?
Yes.
That would be one that,
Exactly.
if we can do that, like, because I know that your and Todd Cushman's thing was very well received by people who do that.
That's a great point, Becky. At our last meeting, the Lieutenant Sifo as well as the two SROs presented, and what kind of trends they're seeing around drugs in the community, and that was taped by SCTV and then shared. So I think that works well for people who can't attend this meeting. There it is. Thank you for calling that up. You know, we had certainly some community members that aren't necessarily standing committee members here, but as talk about access, right? So, you know, if they can't do the larger community forum, maybe it's here at this next meeting and then we tape it and then share
Have it available.
I think that makes sense.
Hey, any response to Sue? I see our Representative Hampton is here, and we jumped over your part earlier. Would you like to have any updates or sharing you'd like to?
May I approach the bench? What a crowd. I did not bring nearly enough handouts, so maybe the town of Simsbury and the state will share the cost of, I did bring about 10 copies.
I think
a lot
that's
of
an
paperwork.
unfunded mandate.
It's great to be with all of you. I've been watching you, tracking you and watching you all on TV and all your great work, really incredible efforts on this very, very important issue of mental health. And as your state representative, I'm here to be supportive. I was appointed this year vice chairman of the Children's Committee, the Committee on Children, which is a great committee which has cognizance over DCF now. We do have cognizance over DCF. And this is the committee that took the ball after the events of Sandy Hook to add the mental health component that was so necessary to implement a statewide mental health plan so that events like Sandy Hook do not happen again. I brought you some documents that are available online, and I'll send you those links. Perhaps some of you could share with the rest of the class.
John, as you're talking, could I ask you to grab one of the microphones?
Yeah.
Or even pull up a chair if you like.
I can sit.
You know what?
We would allow that.
Let you
I
have
can
this
bring it in.
seat. I'll move
Bring the
over.
chair.
Yep.
I think if we scooch in two different directions
It's okay.
here.
Nope.
I don't want to kick you out, Martha.
I'm gonna be public audience for a while.
You are? You're going to heckle. All right. Hi. So this year, the Children's Committee is going to look at a variety of things. We screened bills yesterday. Some of the areas we're looking at, in addition to mental health, are safety of playground equipment, Lyme disease education, children left in hot cars is a big issue, sadly. Animal-assisted therapy, concussion prevention, intervention, which is huge, childhood obesity, school-based health centers, which I'm learning more about, which seem to be really successful across the state. I don't know what the nearest one to our district is, but we're seeing some real success with students actually volunteering and coming for help and filling in the slots where needed at these school-based health centers. So I'm looking to learn more about these and the successes, and our chairman states that there's some real promise there in terms of great treatment for our students who are actually coming forward and asking for help, which is key. We'll be looking at pesticides on school grounds, trauma-affected training, better intervention for trauma training, as well as enhancing the Reach Out and Read program. But the biggie that you're all interested in is the mental health aspect. We did put together a Public Act 13-178, which was the act concerning the mental, emotional, and behavioral health of youths, which is now gives the charge to DCF and the Office of Early Childhood to implement this EPIC mental health plan. And now we are at the stage where we do need to implement the plan. I brought a summary of that bill, which I'll pass around. Take one and pass it to your neighbor. And I also brought a progress report on where we are with the behavioral health plan, which you could take a look at. And then, again, I could send all of you links to this. Many of you have probably read it, but this is a summary of the Adam Lanza report. which has many common themes. If you want to take one and pass it along. I promise not to be wasting any more state paper. Just sending you more emails. But it's pretty compelling to break it down, Adam Lanza's experience. That's for you. Take one and pass it along. How many members are the committee actually there are there? This is the full complement.
We didn't take it to the
Or I kind of like to see that.
That's great. Such great talent, many resources, great perspective at the table. So the hard part this year will be actually implementing the plan and bringing all the pieces, all the moving parts together, all the different agencies, and making sure that we do this right. Oh, thank you so much. And candy. It's so great that this entity is established because you can monitor our progress at the state capitol. If there is a bill or piece of legislation that you would like to put forward, I could do that for you. The proposed bill deadline is Friday, but as a committee member and as a committee, we can put forward bills up until 30 days from now. So if you want to put forward any related legislation to mental health, I'd be happy to do that. I've already talked to some of you about putting forward legislation, and that's my job, and we can work together on advancing it and have you come down to the Capitol. Some of you have been there to testify and tell your personal stories. And but connecting with all of you is so important for me and for our constituents, especially our younger people who are just buried in this epidemic of mental illness and adults as well. So I'm delighted to be with you and delighted to be on the Children's Committee and to look forward to this year and the next year to help you help our citizens. And it's an exciting time, but what great things you've done already. So, Mr. Chairman, thank you for having me.
Oh, thank you, John. Any questions? Sure.
Where we stand with when you bring a child in to, let's say, Children's Medical Center, to have them evaluated for commitment. The evaluator is a doctor who says they don't need to be taken, they don't need to go into inpatient treatment, take them home. What's that? You have to have a PEC in order to get your child into. Where do we stand with that?
I don't know, but I can find out. And that's a piece that's critical.
Piece. Yeah.
So you're taking a child to
Physician's certificate. So
Yeah,
you're asking
commitment.
you're asking about if someone's committed against their will, like involuntary.
Right, like a child. Like you bring a child in, child's in crisis, you sit in the ER for, let's say, 12 hours. And then a psychiatrist comes, looks at your case, looks at your child and says, you can take him home. It's your responsibility to take care of him.
And that's it.
And that's it.
What would be your ideal situation in that
They
case?
they would have them committed or find inpatient treatment. It wasn't until my son was 18 that we were able to get a PEC.
What is PECs?
It's a physician executed commitment. So that means they're a danger to themselves or others.
Yeah, and Connecticut apparently is
And
notorious.
it's hard to get. It's not easy.
Really hard in Connecticut, that the pendulum is sort of swung the other way.
Right.
To privacy, and privacy is important, but we're losing too many people.
But even a child, like when you have a child and you say, I don't know what to do, I don't know how to take care of this child, I can't take them home, and they say, well, you have to, it's your kid.
Yeah, after 12 hours.
I think there should be better standards of,
Can I just throw something out? One of the individuals that Sue was asking about or mentioning earlier at the Institute of Living is a colleague of mine, and she's a physician down at Children's. She does this like a lot.
Yeah.
So it would be helpful, I think, to bring that back if we do have her at a future meeting to ask, because I don't know how much of what you're talking about people are aware of, but it's a great question. And these days the hard line that's sort of set for inpatient status is if a person's in danger of hurting themselves or other people, generally they go in. But if they're clinical to that, it's really up to the doctor's discretion. So that's really what you're asking about.
Would you recommend any enhancements legislatively to?
That's a great question. I think I'd rather ask Dr. Namro, who Sue had mentioned earlier from the Institute of Living. She's someone who's really in a position down there to do that on a regular basis. And I think your question is excellent in that we are really in a mental health crisis as far as that goes. And frequently, when they're in a position like that, there's just no place to send them.
Well, and I think they have criteria. The physicians have criteria
Absolutely.
that's governed by the government
Yeah.
also. They have criteria that you have to meet in order to get on inpatient.
So possibly we could
Yes.
change the criteria?
Yes.
Yeah. Yeah, I'm sure. How do we spell Dr. Nemrow?
Namerow. First name's Lisa.
Okay,
She's the chief down
great. I'm sure she's been part of the mix, but
Yeah.
I'll look into it for you and see what we can do on that part, because that's very important.
Yeah, I sat on a panel with her last week over at Hall High School, and she was very vocal about just this particular issue. And so she would be a great resource to begin to have the discussion, because there is a huge gap from where a young person is at risk, and just as you said, it's doctor discretion, and I certainly would think we want to keep it there, but how do we create better guidelines, I think, and parameters to what is the diagnosis to which a young person needs to get a bed and get treatment. So, doctor's great.
She's one.
Top shelf.
Yeah, that's a pretty big missing link, and I guess, and again, I think Connecticut is behind on that, and I think it'll be a very lively, I'm sure, discussion on the issue, but really important to, and I'll bring that back to the chairman and get her feedback on it. And have any of you analyzed the Sandy Hook report on your own, or the Public Act from 2 years ago? And do you have, is it good, bad, and different? Tom, you have your...
Yeah, obviously it's a pretty important issue, not for myself, but also for my agency. I think we need to implement.
Yeah.
I mean, that's kind of where I think it is. I thought it was done well, and I don't think we need to rehash. I'm a big believer in safe messaging, and there's a lot of pretty grim stuff in there. But I think there's been some legislation, but I think we're at execution level now, and I don't know if the execution is really that strong. Yeah, you agree with me?
No, that's where we have to,
So
folks like you.
I'm
Yeah.
looking forward to this session to really put some meat on the bone.
Sure.
To be sure that we can implement it, so that, folks like around this table can support it, and to be sure that it can be carried forward. I mean, that's the key, I think. It's been researched enough. I think it's been studied, researched.
Sure.
And folks are, at least from my perspective, are pretty clear on it. And I think the early legislation was good, but now execution time.
Yeah, and it's a big beast, and there's a lot of moving parts in different entities, and it's coordination of all those entities.
And departments.
Yeah,
State
the different
departments.
silos and.
Right, how do you get them all to interconnect? It's going to be was it DCF or DEMIS or DOE? I mean, there's several partners here, and I've seen state departments interact and work. The Suicide Prevention Initiative in our state is one of them. So it's not impossible. It can be done.
And I'm sure as we roll it out, we can work out different kinks that we see in your voices and perspective will be so important. And again, the good news is DCF will be under the cognizance of the Committee on Children, so we'll have a little more oversight over how things unfold. Any other questions, or did folks have any other critique of the bill and what the state is doing or not doing? things we can do better overall on the mental health front that I can take back. Good or bad, you can. But the good news is we're taking it seriously and taking the the tragedy of Sandy Hook and moving forward to a better place, I think, for our entire state, and maybe set a model for our nation. I think it's great that Simsbury's a model with a group like this. I don't think other municipalities have such a great group of minds working on this issue from so many different disciplines. So it's so important that you continue to provide me information and ask the questions and make sure that we get the right language in the legislation and the right results from the legislation we push forward.
John, will there be discussion of what they call outplacement commitment, of requiring somebody to take medication if they're not going to?
Well, that's related to. Yeah, there's definitely going to be discussion on that. Do you have an opinion on the?
As the parent of a young woman who works in a psychiatric hospital and who sees a lot of people come back who have somehow escaped from that in New Hampshire, I think it's a good idea because it saves people from hospitalization repeatedly. If there's some relationship-based capacity by whatever agency to stay with, to keep in relationship with the person and to make sure the person is taking their medication, and that same relationship to provide whatever other services the person needs.
That's lacking.
It's lacking, yeah. But it's important for the safety of people who interact with patients who have a real need to be medicated.
Make sure that's part of the dialogue.
Like med compliance program.
Do other states that you know of, are they doing things better than we are on all of these issues, or those?
Massachusetts does a pretty good med compliance program.
It does.
Yeah. Yep.
New Hampshire has conditional discharges for people from the state hospital system, at least, where the condition that one of the conditions that has to be met is that they take their medication, and then they have a caseworker who follows up with them, and if it doesn't happen, they bounce back in before they get so far out of control that they end up in the secure psychiatric unit of the state prison system, which is a good place for people to avoid.
And in your case, you went home with your child with no resources.
3 times. It was
Yeah.
the 4th time after he was 18. So we were in the ER 3 times.
So where would you turn, or anyone like you at this point in time with your particular case, another parent maybe who doesn't have his no. Yeah.
That's the point, yeah.
No.
I mean, I'm a nurse, so I knew what a
You have it,
PDC was,
correct.
and I knew when he was 18 what to say.
Yeah.
To get one.
But other families and different demographics will be just
Lost.
lost.
Yeah.
I had similar,
Yeah,
you know, experiences, and it's very frustrating.
frightening.
Yeah.
Yeah, especially if you get into the urban areas and the disparities in income and
211.
that's just a vast
The
wasteland.
police help.
It's
About 10 times.
Yeah.
You know, I mean, yeah, there was a lot of, prevention that we tried that just wasn't effective because there was no other place to go. You kind of hit that dead end, and now what do I do?
Yeah, it's pretty incredible. It's scary.
I'm thinking about our last meeting when we discussed when the police did their great presentation. And I had raised the issue of how do we get parents beyond the denial stage and actively involved in wanting to treat the child. And what you're saying is you can get beyond that, but there's a brick wall there.
Mm-hmm.
The system needs to look at that and see what they can do. I guess we're giving that to you.
Sure.
But and I think it's really great that you've spoken up the way you have. That's pretty
Yeah.
impressive.
John, if I could just add to that, I think there's a delineation too between mental health and substance treatment in that, you know, I've worked at facilities where patients will go out for a smoke break at a substance facility and literally just walk away, you know, because they're not locked facilities. So I think part of, you know, the issue with substance treatment is there's not the homicidal or suicidal necessarily. There isn't that line, you know, so it's even more subjective as to when does a physician jump in. They could be just as or, you know, more dangerous. So that I think is certainly lacking across the board.
What else can we take back and do for you?
You could accomplish that.
By the end of the day tomorrow? Is that what you're-
That's it. We want to report.
I have a question, and I think you and I have talked about this
Mhm.
before. And I did read as much of this as I had gotten. I'm grateful for this copy. When I read it, one of the things that I found startling, and it's disturbing to me, is you've got this kid, and he shows up at several different facilities. He from Yale to, you know, local whatever. Mom pulls him out of treatment, doesn't really want to support that, really wants to look at something else, and a lot of her issues are all wrapped into this kind of marble cake here. So the problem is to be in front of staff at Yale or teachers in school or people anywhere, and where are the mandated reporters, and why isn't somebody saying this is a kid at risk? No one wants to, and I know because I am one. It's not easy to pick up the phone and say to DCF or whoever that we need intervention here. You need to follow this up. But I know I saw that as a piece that if that had been in play, that we might have been able to change some of this.
Well, is that just indicative of the cultural pendulum swing toward more everything's privacy now, and it's just, you know, the right to privacy and privacy and privacy, and then but we're also in doing so, you know, it's like see something, say something, you know, in the post 9/11, you know, I think we all now are more inclined to intervene. We are going to get into that big debate of I'm sure in the larger legislature of privacy issues, and but
maybe it's my misunderstanding, and you probably can, and I don't know your first name.
I'm Mark.
Hi, Mark. I'm Sharon Wilson. It's nice to meet you. Is my sense, this is just me and the way I look at things like this, is that I have an obligation to report that. And if something happens and I haven't, and I have sat with this kid, and I'm a trained professional and licensed by the state of Connecticut to recognize these things, then that's my neck that's on the chopping block. Which is a complete flip over from what it was many years ago, which was the pediatrician couldn't even call unless he could prove it. I mean, the burden of proof was on the reporter. And then they changed that because they thought it was going to be so much more helpful, and I think it's got that potential. And I think people did adhere to that more rigidly and with more commitment initially. But I don't know, when I read this, I said, where do there's all these holes that this kid just fell through. I mean, I can't imagine Yale and teachers and the list goes on, that whose path he crossed and they crossed his. And nobody picked up a phone and said, we need help with this.
well, where would you repair that? Would that be better enforcement of reporters, or I
think everybody needs to be reminded. Does that make sense to you, Mark? That everybody needs to be reminded that they've got a responsibility, that they're licensed and certified, and pediatricians and family physicians and dentists and anybody that's licensed to help, any kind of healthcare provider that's licensed by the state has that responsibility. All you have to do is think something's wrong, and say, and there's no. I think someone said to me once, "But yeah, but wouldn't you get sued?" I said, "No, I'm going to get sued if I don't do it."
That's the HIPAA and issues maybe it's just gotten so out of hand.
Maybe it's a little too enforced. You know, like where does HIPAA, when somebody's in danger to themselves or others, HIPAA
Yeah.
you have a right to inform, right?
Yeah, HIP is out the window at that point. I mean, I think
Yeah.
you hit the nail on the head that there's sort of a mixture of what you were saying, Sharon, which I was saying. I think
Yes.
people are just scared, you know? I mean, I've been in the position to have a patient in my office who I knew was really unsafe, and they don't want to do anything about it, so I have to call the police, you know? And it's awkward and uncomfortable, but I know I'm doing the right thing. And
that's important.
so, I mean, I think you're right in that, you know, I'm probably a little more used to that than maybe a teacher might be or someone else who doesn't experience that.
Right.
But I agree with you. I think we all have that obligation that if you see someone with an attention deficit, they're not likely to be homicidal. But if you see someone who's experiencing, you know, an overt about their violent thoughts and perhaps, you know, their paranoia or other things,
Right.
someone should be contacted. Sure. And I don't know if DCF's the right place, because I've made calls to DCF about 17 and 18-year-old kids, and they won't take those calls.
I know.
No.
So sometimes it's a matter
Maybe
of...
we need to be reinformed as to what is the path we need to take if we are indeed responsible.
I mean, sometimes it's a matter of getting on the phone with the parent to just say, hey, I'm Johnny's teacher, and I hear Johnny talking about X, Y, and Z, and I'm really concerned about it.
But then the parent says, it's none of your business. Johnny's
Some do.
just
Some do.
He's just a unique character, and he's got character.
Some
He's
do.
just different, yeah.
And you know, I mean, I guess at that point, if you're in a school system, you let the administration know that there are some things you were concerned about, and
Yeah.
you keep an eye on them, you know. So,
That opens it up at least to more than one eye.
absolutely.
And maybe there is somebody in that group that has an idea of what to do next or can connect with the parent in a more effective way. But I still, as someone that's mandated to do that, I need to know who to call.
Yep.
And as you say, the police are always, and I'm sure this involves folks like you, could be a target for that. I think this kid is
Yep.
a danger to himself and others.
Is everybody in the school system a mandated reporter? Is a custodian
Yes.
a mandated reporter? Okay.
I think the school bus driver even.
Maybe. Okay.
John, really quickly, you came in right after there was a quick presentation by the school doing some education programs with the students and parents, which congratulations, that's prevention work. And I sympathize with the conversation here immediately about treatment and young people, and mental health is all ages. It's just not youth, it's older adults. We lost somebody last week in this state to suicide at age 13. So it's you know, it covers the gamut of age. We really need, and I fear, as I look at, and I'm very involved with kind of the legislative advocacy thing with mental health, that we lose that prevention perspective. And I know sometimes it works and it doesn't, but boy, the focus and where I see, especially from DCF and DEMIS, Department of Mental Health Particular Services, that and with all the change of the Health Care Act and all that, there's a move to to treatment, and it certainly needs to be focused. But boy, we can't lose prevention work, and prevention work happens at the community level. I know Mickey's department has done a lot of prevention work, the school, and I salute the school for doing that kind of thing, because that's really where if we don't work hard to prevent and educate and to talk about warning signs and risk factors and all of the things connected, not only to mental health but to addiction.
Sure.
And all that, then we miss it. We miss it. And then we're going to be struggling with what you've heard stories here with families here where there's young people, adults, or whoever, who are struggling with this issue, can't find help. So, and that's the hard one. I heard about the $2.8 billion deficit that we're going to all fight with, or at the legislature about, and so where's the dollars going to be, and how do we divide up? We're literally going to be pennies. But we can't lose the focus on prevention, because an ounce of prevention will save a whole lot of money down the road when it comes to having to find treatment for folks, because they've gotten to a place and they haven't had the opportunity to learn and educate. There's no secret formula here. It's just something that we got to work hard at and be very community-minded about the prevention side of things.
We see it's not an easy thing to do because you have to balance off the privacy, the freedom, and the need people have for treatment. So we appreciate the struggle, and any way we can be supportive.
Yeah, I'll be interested to look at some of the other states that might be doing it. We could do some research on that, and I'll talk to the chairman about the language and the attempts in the past to deal with it, and whether we can try this year to make some changes that would help you.
Florida law too. If they leave treatment, what's the name of the?
I can find out for you.
In Florida, if they leave treatment, they can get arrested and be put back into treatment. If they leave, they're really not allowed to leave, and I forget the name of it.
Well, I just remember former Rep. Schofield saying, Connecticut is one of the hardest to get people committed.
Because I can tell you, there's no
Just-
16-year-old that's going to want to go in treatment, stay in treatment.
Yeah.
But there is a law in Florida that you get them down there, you get them in treatment, they can't leave. It's
Right.
almost like a PEC, but it's a different, it's a government, it's legal ramification, yeah.
In addition to the PEC, you could also look for, training for ER docs to say,
Right.
to provide, resources, better, on everything else they could provide resources. But in terms of mental health, it sounds like they're lacking to say, go to this clinic or just go home.
Yeah,
That's not the-
outpatient,
Yeah,
we can go to the IOL outpatient, but guess what?
Yeah.
They learn how to do more drugs in outpatient from the other people. As they walk out the door to have their cigarette or whatever, they learn a lot. But too, and I think with the HIPAA and everything, too, is parents, as parents, we're always the last to know. Because you do have a sense of denial. So I think, to say something to you probably will get, no, not my son, or not my daughter. That's normal. And the more you hear it, the more you're like, oh, okay, there's something going on here.
Yeah.
And I think that non-judgmental, oh, these parents are just, it's normal.
It's very difficult for people to
Yeah.
admit they need treatment and then find a way to get it once they are at that point. even.
Right, yeah.
I believe you had a comment.
Hi, Freddie.
Mr. Knapp, just a quick question, and I'm not sure where it is in the legislative end, and I'm not looking to take anybody's freedom away. When it comes to, you gave us a copy of the Sandy Hook incident. In the legislative, what are they looking at as far as pistol permits? Because I know the process that people have to go through pistol permits, and I know mental illness comes into a part of that. There's nothing to do with, a person coming in who could have mental illness for me knowing there's a problem, and he still gets his pistol, or she gets his pistol permit. Is there anything legislative that's looking at that yet, or trying to determine how they would go about?
No, that was something we did talk about that did not end up in the final. Is that something you'd like to?
Coming from law enforcement, I guess it's frustrating because I know sometimes blame gets put on law enforcement of why was that pistol permit given? I know the checks we have to do, and there's nothing to do with mental illness, nothing.
So somebody comes in here for a permit, what do? They
They fill out an application, we do a criminal history check on them. If there's nothing in them, they're issued their pistol permit.
How long does that take?
Off my head, I don't know. I don't know off my head.
So,
At least 30 days.
So it takes.
As long as they go to a firearms training, they pass their qualification, they have no criminal history, no protective orders, no restraining orders, nothing in effect, here's your pistol permit. I mean, it's not like it's a one-day thing, it could take 30 to 45 days, but as far as the police chief anywhere to deny that application needs reason. And if there's no reason, I don't know if there's a way for the state to look at, because of HIPAA, if, a psychologist or psychiatrist or anybody could say, well, time out, this is one of my patients, patient be getting a pistol permit.
This will be an easy one, Fred, to take back. This will be really non-controversial. I'm sure with. Thank you. Thank you for that.
The process isn't difficult.
It is.
Treatment history asked about? That's not a part of it at all?
What was that, Mark? I didn't.
Treatment
history?
Off my head, I don't know, but if they say no, I wouldn't know.
That's a good point.
So, I'd love to see an application, a sample application.
There is we had a gentleman before I came up here come to me with some questions about a pistol permit, and I'm going through the application with him, and I see nothing but mental illness.
Interesting.
think
So
we're all sick
you're
of
asking, you know, it's a, you know, it's a big privacy issue. It would just be a Pandora's box, I'm sure, for that.
I don't know if there's some
I mean, I see
system
the.
where we enter names into them and it goes out to the
Yeah, how would you
doctors and they
even-
say, yep, that's one of my patients, somehow, I don't know.
So where does
how it
that begin and end? If I'm treated for depression once in my life, do I have
Yeah.
to fill that out?
And I don't
Do you
know.
think? I don't know.
At one time when I was
What do you-
15, I was depressed, and I was put on medication, therefore does that flag it? I don't know.
Yeah.
But there's got to be something more, because I know for police departments, we only go off of criminal history and what that person's telling me. If there's no criminal history,
There is a legal mechanism to take somebody's driving license away, and that's up to the doctor to
Yes.
file with the DMV. There could be something along those lines that, because not everyone who has mental illness is inappropriate to carry a weapon.
Well, yeah, that's why I mentioned if you're treated for
No,
depression
I'm not
20
looking to
years
take-
ago,
I'm looking at,
doesn't mean
there
that.
could be someone out there who is, how does that person get flagged?
When the ER doctors do have an obligation to say, make sure when you bring your child home, there's no firearms in your house, no weapons. I don't know if they do that in the adult.
I don't know.
I know, because I know with a child, they say, because that's why the whole thing with that, I'm like, oh, well, they do say, make sure there's no firearms in your house. But you can say, no, there aren't, nobody's
Right.
checking.
I've had parents say there are, but they're secure.
Right.
They're not always secure.
I will look into that for you.
Oh, I found it's called
That's
the Marchman Act.
Marchment?
Marchman, Marchman Act in Florida.
Okay. That's a great question. And I'll do my homework on that. And will you come and
Yes.
and help me out down at the Capitol when things start to? No, it's really important to talk about. But as we're finding, it's going to be the devil will be in the details of.
Todd, if I could bring up another area, with the advent of increasing data being able to be shared of medical backgrounds, I know that there are states that are looking at increasing the ability of people to be able to have their full medical records from various sources portable. And actually, in other
Electronic
countries,
records.
there's more of a culture where medical data is owned by the individual, whereas in our country, it tends to be owned by the doctor. And in a number of scenarios, when you take a look at it, and I think Adam Lanza speaks to this, as they were hopscotching around from different professionals to different professionals, they weren't able to see
The
all
records.
of the background and subtleties that kind of help them to effectively assess things.
And quick enough too, probably,
right.
because it wasn't electronic or.
Right, and there's more and more websites that are available that people can access to have all of their data, and the confidentiality and privacy issue is kind of a difficult one to deal with, but people being empowered to have their medical data with them that they can bring to a doctor so the doctor has it all right there is something that I think is a lot easier to promote. And I think in a lot of mental health issues, more and more we're realizing that every human being is totally unique, that the combination of this drug with this experience, this background, this family history is totally unique from other categories. And the more that doctors can see the total background of an individual, the more they're going to be able to see those categories and connections. So, and to me, it's just a much easier area to be able to kind of make some gains than really trying to deal with the whole, confidentiality, privacy issues.
Yeah, thank you for that.
If they have a way of if I'm doctor shopping for medication, that pharmacist will see that 2 days ago I had this medication filled by Dr. X. That pharmacist now can call the other doctor, look, this patient already was here getting this prescription. Why can't they do that with medical records?
As a matter of fact, the pharmacy databases are phenomenal. And
Correct.
the way that those are being used by doctors and
Yeah.
by druggists.
Why
and
can't they do that
everywhere.
for something else?
Not all medical records are electronic, that's probably
Yeah.
why.
But they're becoming to be.
Yeah.
But increasingly they are,
The state
right,
of
yeah.
Connecticut, pharmacies are required, it's a whole database system, but physicians are not. State law requires that when a pharmacist fills a prescription, so if there's doctor shopping going, especially
they know it.
with prescription drugs, whether opiates, whatever, they'll know the problem is the doctors aren't required.
Right.
And so, and that, I know in the last legislative session, maybe 2 legislative, there was a lot of conversation and discussion about that. So the move was, well, let's get it into all of the pharmacies, which it is. So you're a registered pharmacist and you are writing scripts in the state of Connecticut. You are required to put those scripts in that, I can't remember the name of the network now, but it's in the state. The move now, it's voluntary for physicians. And so the physicians that I've been talking to who are getting more comfortable with this is saying, this is a good thing. But it's with everything else that doctors have to do where it comes Medicaid insurance, whatever. Just another thing to actually go to is where the hesitation, at least from the folks that I've talked to, but it's really working across the state. You talk to the DEA agents, Connecticut is one of the states that are really getting control over the prescription drug issue, and it's because of that mandate.
We're starting to have access to that now.
Yeah.
Right, and that's
That's a great, those prescription databases are transformational in terms of the ability to, because now you can use basically software to analyze what's going on with people, and that's the whole movement of getting medical records basically to a similar place. And
I think they're supposed to, by a certain year, be all doctors or be fined, but the doctors, I know, say, just fine me, I'm not doing it.
Well, there's ultimately they'll have to. Part of why doctors don't is because there's a lot of places they sell medical records for. So for example, anytime you apply for life insurance, doctors charge a very large, significant fee to copy your records and send those to insurance carriers. So they actually make a fair amount of revenue off of medical records.
The more standardized, like one company sort of.
Right.
Interesting.
But it's just, to me, it's an easy area because there's so much movement now within the economy, within the federal government relative to medical databases, that it just seems to me an easier area to make some gains, and directly relates to a lot of situations where people feel they don't get good treatment, in part because the doctor's not seeing the whole picture.
That would be like a continuity of care.
I think it's the
Yes.
Department of Consumer Protection. It falls under the Department of Consumer Protection. Is that registry, I believe, is where.
It's under drug control.
Oh, yeah, yeah. Kind of the Dropbox thing, that whole area.
You know, in Europe, when people go to their doctor, they bring a flash drive with all their medical records right there on the flash drive. You know, and think about the ability of a doctor, you know, to utilize that information.
But the flip side is there the potential for abuse of that information?
Well,
that's what I'm
if
going
I control it, I'm the consumer. I'm controlling my own information.
Yeah.
If you had
It's
it on a
hard to-
flash drive.
But do we, in this day and age with hacking and everything else, are people going to be worried about? I'm just thinking about the other side of the argument that.
Right. Well, that's why you have
your stuff is out there,
Yeah.
and back to your.
But it's already out there. Think about it.
Well,
It's
but
being
the fact that
bought
I had anxiety 20 years ago, but now I want a gun permit, are people gonna look at that as discriminatory? And that was 20 years ago, and I should.
That would be up to the legislature to decide what is considered, what's not considered.
That's a big.
Doctors and what shouldn't be.
Yeah, that opens up a big.
And with that same argument, though, will that force people to hide it? Will they not seek treatment if they know there's a penalty associated with that? Are they going to necessarily disclose what's going on with them?
Yeah.
That's the other flip side of.
Or do you require somebody to get a sign-off by a doctor before they get a gun permit and say, I can't say this person is 100%, but this person met with me.
A medical
I spoke
sign.
to them.
Yeah.
We have to get waivers all the time.
It's like with a driver's license that you said earlier. Some sort of sign up.
And you're not hiding it. It's just you're getting a sign off from a doctor.
Yeah.
I know some doctors are going to be afraid to say, well, time out. Am I going to be blamed? God forbid something should happen, but I don't know if there's a way. One more step.
But having it on stuff online is already problematic. I'm fighting with Medicare because I was billed for a visit to an urgent care place in New Britain where I've never been.
Yeah.
And it's on my medical record. Medicare paid, my insurance paid, and I'm the only one that's not paying until they take it off.
Yeah.
So it's because there's online records that it could have been just a clerical error, but,
Been off by one number.
yeah.
Instead of a 3, they put a 4.
Yeah.
That's you.
And there I am. Who knows what they have that's on my medical record.
But again, if you
Who knows
had
what they got
con-
treated for? that
Yes,
they're
I
gonna
know.
find
That's
out.
what I'm saying. I may not ever
you had
know.
control of your medical records, it would be easier.
It would
for
be
you.
easier. Yes,
Right.
that's what Chris is saying is safer because this is not safe.
Well, I was just meeting with Simsbury Bank this morning, and one of their big issues is their fraud and the hacking and the security, and so if they're dealing with it on their end, just imagine what's going to happen with, could happen with people's medical records. So I see the merits, but I also foresee a lot of debate, healthy debate on the issue.
We need to find that middle of the road.
Yeah.
Where it's close to
The balance.
something that's balanced rather than this pendulum swing, which is the normal way for things to go. But,
Sure.
I think you're absolutely right that it's gone too far in this direction, and we are not able to do as much as we could if we had information. I can't imagine being in law enforcement and having someone sitting in front of me and I have no idea whether,
Yeah.
did they spend 2 years in a juvenile detention program and then I don't know about it and I'm going to give them, I don't know.
They could be a 30-year-old person who spent a year in IOL. I would never know.
Sure.
And that's got to be not a good thing to take home. It's
Yeah,
like,
maybe the
oh.
doctor sign-off could be a compromise, but I'll be happy to research that as well. It's great input.
Yeah, I'm just not sure what. There's
Yeah.
gotta be something better than what's being done now.
Sure.
I think
Or if there's a way to have mental health professionals put some kind of alert in place on people that they think could be a risk, not even knowing that they might apply for a gun permit, but just that they're in some kind of
But I would have
database.
to have a database to go to.
They could.
What's that?
I would have to have a database to be able to go to. and
Right,
find
that's
it.
what I'm saying, have some kind of database that
Yeah, it would have to be.
there's an alert.
Place. Parking garage for all.
Okay.
It'd be like a login safe place.
Yes, yeah.
Yeah, okay.
All right, thank you.
Only law enforcement officers can
Yeah.
get in there, people issuing gun permits. You just solved a big problem. That's really
Thank you
good.
for your time and for having me, and I'll come back for sure. And I'm going to share with Lisa my contact information, and if you don't mind sharing the distribution list, so I can send you these documents and others of interest, links to the Children's Committee. There's a wealth of information and reports on mental health and all the other different issues that we're addressing. And then you could write to me as we craft legislation and try and get into the depths of these issues, and you can help me do the right thing by all of you, because lots of great talent and knowledge around the room. So I'm happy to be here. Thank you for having me. Thank you to the first selectman for starting this epic beast that has grown, and it's great. It's great, and for the chairman and leadership, I really appreciate the opportunity, and it's going to be an exciting year, and hopefully we can get some great things done. So I appreciate it. Keep in touch.
Thank you, John.
Yeah,
Thank you.
absolutely.
Thanks, Jen.
Okay. Good presentation there, and I think Sue had mentioned the possibility of a speaker for our next meeting.
Yes, so I come back to the IOL speaker and Dr. Namarau, and so I certainly, but looking at that date, I wasn't sure if I wanted to actually say that date, but I think it makes sense. Going with Becky's suggestion to have IOL come and present here and then have it taped for SCTV for a larger audience. I think that probably makes most sense.
Okay, all right.
So once we settle on a date in the April timeframe, certainly I can make an arrangement with IOL.
All right. Are there other suggestions of other speakers, people we could have in the future that would be of interest to the committee?
I was just going to suggest the chairman of the Committee on Children would be great. She'd come out, I'm sure. Diana Urban and the co-chairs, they'd be willing to. In fact, they're talking about maybe having one of their commission meetings out here in the valley.
Oh, great.
So I just throw that out. They have some good experience on putting together the mental health bill, and so I just volunteer that.
Diana
Urban, represent Diana Urban.
Urban, okay.
One of the other speakers that I took a look at was there's something called mental health first aid training, which is now quite popular, happening throughout the United States, and it's kind of layman's first aid training for recognizing mental health and learning what the resources are. Just one of the CEOs of the hospitals for Demas strongly suggested it. He'd just gone through it, and as somebody at a very high level, he said it was really made for us at this level. So he gave me the contact of the trainers, and whether they come in and do the training or whether they come in and just talk to us about what that training would look like for our community, we could have them come in as well.
I've actually participated in that training through the new safety legislation. It is required for me in my position to attend that training. It's 2 days. It's very comprehensive, but it is definitely in layperson's terms. So if there's a particular, it kind of does mental health 101 and different kinds of signs and symptoms to look for. So thank you for bringing that up.
My agency, Capital Area Substance Abuse Council, provides that. So say the word, we can arrange a training.
Would that be something that could be done like in one night with a talk here, or is it an ongoing thing?
It sounds like it's a 2-day training.
It's a 2-day training. It's
2-day.
mental health first aid. Mental health first aid for adults.
That's great.
And then there's a new one for college students that's just rolled out, but you have to take the mental health first aid for adult first before you can do the college. So, and I can bring to the group some more information about it. There is some expense to it, not outrageous expense, and there's quite a large team of trainers. I'm not trained in that discipline, but I know of many who I can arrange to bring in. And again, it's the material basically is where the cost lies.
So that could be something we could sponsor for the community at large.
Yeah.
Sure.
We would do it through Social Services Department. We can do it in a bunch of different ways, but it's good stuff, really good.
We can come back to this with other ideas for speakers, but I want to jump over. Stephanie has done a fantastic job putting our website together. It looks fantastic. I don't know if it's been open for everybody to take a look at, but it's here. And she would like a little feedback from us and
What we did, we worked on this a little bit with Woody, Cheryl, Sue, and I put together. We just took things that we had. Right now, it's landed on social services. It will be its own website, so the stuff on the left won't be there.
It's not live.
Because it's not live, that's what, but we had to land it somewhere so that you could look at it. So the left side won't be there because that's Mickey's site. What we did is we put the mission up the top, the meeting and location, and then you'll see the red warning sign. We felt we needed to do a 911 and a 211 and a national suicide prevention. This is what they use on the 211 website. So I didn't want to create something new. I wanted to use one that was established but open to that. If you think the different warning is in order, that's what they have on the 211 site. And then can you click through the links that we have, Steph? We'll go through those quickly. They open up to their own pages. So these are what we have in the book, Community for Care.
Yeah.
So we just took those out. We couldn't copy the whole book because there was, Mickey linked into it, thank you, there were copyright. Oh, and I forgot, Becky was on that too.
Well, I think did you find out
Yep.
the copyright issues?
No, Mickey found out we can't copyright it. So that's why the whole book isn't, but you'll see that's basically what's in the Community for Care. We just retyped it. All right, you want to go back?
Are there any state agencies there, Demas or anything?
We can get you a copy of the book. We could go on to other things. Then we prioritized, we went through with Sue and Cheryl and Woody and sort of put them in order. We wanted social services to be a direct link on our website too, because it lists all the other stuff you have.
Would you pass that to Jen?
And then the police department has a tremendous amount of resources, so we wanted to make sure that we had a link to that. With all the conversations we've had about how drug addiction often starts in the home with prescription drugs, we wanted to make sure the community knew about the Dropbox.
Not to interrupt you, but we collected 800 pounds of unwanted
800.
In the year 2014.
which is why we wanted to highlight it. Because what's out of the house is out of your children's hands.
You know, and on the Dropbox, you should, I don't know if they have information, I can get it for you, but what you can and cannot put in the box.
Yeah, it's on there. It's on there. You can't see it from here, but it's on the box. See that little circle with the X through it?
Oh, okay.
It's on the box, what can't go in there.
Right, but if you want to educate, you want to make the site, so I'm at home, I got medication I want to put in the box. If I'm on there, I want a link to see what can I put in and what I can't.
I can give you the flyer that we hand out. There's
Perfect.
someone downstairs in
I can
town
add
hall.
it, yep.
You can have the flyer that says what can and can't go in there.
Okay, great.
The parents' guide is just basically talking about it. You know, where you
But the parents' guide is where you can get it. Where did we get that summary? It's on, I don't remember. Maybe I wrote that. I don't remember.
What's that? It was the press release.
Oh,
That's
this
right
is
from
in the press release.
That's the direct press release that we sent out when the booklets were distributed at the open houses at the middle school and the high school, and then the different locations around the Simsbury community.
I couldn't find a specific domestic violence
Okay.
thing, so I just put the crime.
A guide for victims of crime. Is there, Mickey, there was something on domestic violence that she couldn't find. Do we have that?
We have it on our site.
Yeah, so we'll get that from Mickey, and we'll add that. That was, I don't know where we got national resources, because that wasn't one of the things on our list.
No, this was what I had before, but I didn't delete it. But I
Okay.
can delete them.
This is what
But there's some of
Stephanie
these are
did
from
on her
the-
own.
Some of them are from the book.
The book. Some of
So I
them
don't know if we want that. That wasn't something that came from our committee, so we,
I can just take
That
it
was,
out.
I think those were in the original booklet from the Community of Concern.
okay.
Yeah.
So take that
And we.
out.
Well, no,
well,
not
we-
yet.
It's, we couldn't take it out of the book anyway, so
Okay.
it's there.
Hey, it's another set of resources.
Yeah,
that
exactly.
people might find
Yeah.
helpful.
Okay.
Yeah.
It's just links, not take up much room.
Did you
Okay.
click through and check them? Because I know
Wanna go to
when we
state
did the
before we
first
go to
one, we had
national,
Mickey
maybe?
checking all the links to make sure they.
Yep,
There
but
were
before it
some.
goes live, I'll check it
Yeah.
There were
again.
some, I think there were some.
But I did, yep. And then same with these, they just came out of the, you know, they came out of the book.
But these need to be vetted, because we haven't, these are not things I gave you.
Yep, they
So,
were just, yep.
just in the book. So if those, where did you get those, Steph?
In the book?
Oh, in the book.
There's the original
Okay.
book that.
In the original book. So I would, before we do that, if Mickey, could you vet those and make sure that there are things we want on there?
Mhm.
Okay.
The SAMHSA website has a pretty good user-friendly treatment resource finder. It's set up for geographic areas, the whole country. And that might be a good link to have, both for mental health and for substance abuse.
Okay. Can you,
SAMHSA.
what's it called? Samson dot?
SAMHSA.
SAMHSA.
SAMHSA. Okay. Board of Ed?
Was, I just grabbed it out of their literature, so I'm not sure if it's
This is,
correct.
we wanted to make sure that we had the right one. This is the drug and alcohol use by students for the Board of Ed policy, so that needs to be just vetted by Board
I'll
of Ed.
take a look, make sure
Okay.
it's the
right one.
most up to date, but it should, did you grab it off of our website, Stephanie?
Yeah.
Then it is the most up to date.
Okay.
And this is probably, you know, it's this again, but then it was some legal consequence, same thing came out of here.
Came out of the book, so she sort of took some of the resources in the book and put it up.
Yeah.
Do we want that up there?
Is that up to date with the new marijuana laws?
The legal one?
Yes.
I'm not sure, I just,
Kids would
You want to
probably
click
be
on that one?
yeah, they already know it. Gotta get a lot of
It's
drug
pretty well
cards.
known that's been decriminalized, so therefore.
Well, I think what they
Where
think
did you
is
get
it's
that site?
legal.
Yeah.
Yeah,
Right.
yeah. I don't even remember.
My
I didn't
website,
give-
as
I didn't
I
give you
work,
any
is
of
the
this.
highest
No,
hit
no.
page.
I may have just,
And it has been for the
Yeah,
past 2
we don't want you to do random things.
Marijuana laws, yeah. And I basically just took what was on the state,
legal consequences, because they
was
were
on
in
for the
here.
state.
Yeah.
And it's the highest hit page, and I keep looking at my data.
There you go.
And it's
Which one?
marijuana, the marijuana laws, the
Oh, yeah, John, can you talk about that tomorrow?
decriminalization law.
I think on legal consequences, we need people from this committee, maybe working with Officer Fred, to
If you
decide
want them on
what
there.
we want on there, and we probably do. But we need someone to work on that, because that's still a draft that Stephanie researched and put up there, but I don't know that that's exactly what we want. So Fred, would you be willing to work on that in terms of what you think would be appropriate there? Yep. Okay.
Can I please set recommendations from the state?
Recommendations from the state, if you have links for us, sure.
Because Demas isn't in here.
Right.
Committee on Children, is Mental Health Regional Board on there? It's on.
Yeah, I saw the mental health.
Yeah.
Demas is the Department of Mental Health, and that would be a natural, so I'll send them to you for whatever it's worth.
Great.
Yeah, AFSP should be on there, American Foundation for Suicide Prevention. If there's an email address, and I'll be glad to send some recommendations. And
Yeah, well, what Steph can do is email the link to you guys, if you could just not forward it, because it's not live, and it's very still rough drafts. Some of it were placeholders, and we need to work on the substance. But we wanted to sort of get a sense from you if this is moving in the right direction.
yeah.
We could do that, and then if you could get back, respond to Steph, and she'll vet it through Woody and Chris and Cheryl and Sue and Officer Fred, to go over the substance checks, and then we'll bring another draft to you guys. Does that make sense? Is people comfortable doing it that way?
Great.
Okay. And then keep going down. What we put on there, we wanted to make sure that people could, as we do push notifications, because we know that people don't come to necessarily watch. These things are here presentations, but they will watch it at home, as we saw with this. This went totally viral. It was all over the place. Simsbury moms, which is why Dominique Avery then came to me and Heather and Officer Bolter to do a follow-up, because some of the comments were, well, what are the schools in town doing? We're like, well, we just did this to get you aware of what's out there. But I think sometimes that one of the great things about this organization is that we get together and we talk about what the community is doing, because sometimes our left hand doesn't know what our right hand is doing. And that's one of our major missions, is to push out information, let people know that what's out there. And so we'll put up Heather's interview up there as well, so that you'll have a chance to look at that. And as you do new tapes, maybe some go in the archive later.
Yeah.
Like as you do your next presentation, we'll start having a video library of presentations for parents, because they might not want to come because, as you said, there's a stigma still, unfortunately, out there, but they might be curious or need this information and comfortable watching it in their own home. So we're grateful to SCTV for their willingness to tape some of those.
What does push notification refer to?
It means we put it out there. It means you don't go and Google it and look it up. We push it out either through our email, we put it on our website.
Being proactive.
Being
We send it to
proactive
you,
with
you
something.
don't go look and find
Here's
it.
a book you could.
That's a push notification.
Oh, okay.
It's just
So that's like what I get from Clean Water Action when they send me an email.
Yeah.
Okay.
You didn't ask for it, but here it is.
Yeah.
Push it. You need to know.
One of the things we talked about that Cheryl felt was really important, and I agree with her, is putting a tab on the front of our website so that people know which Martha made. Do we have it?
It's on my computer, it's
Oh,
not here.
yeah, okay. But basically, so that if people come to the town website and they're in crisis, they need to find something fast. And Mickey was supportive of that too. And how do they get to a site where they can get information? And that's why when they click on it, the first thing they see is call 911 or, National Suicide Prevention if they're really in crisis. We want to make sure that they know that's where you go first. But that if you're not in an immediate crisis, here are some of the resources you can reach. So that was sort of the idea behind it. And it was really get the information out there, because as we've all learned, that's one of the biggest challenges. And then once we're comfortable with the website, we'll probably do a push notification through the schools and through the town's email, letting parents know, hey, there's this website here. You can find it on the town website, and it has local resources, national resources, where you go for help. And it's a beginning. And as we work with John and the rest of the community, as we get more resources, we can add to that. And as there's press, we'll probably add some news release there too, so that people can look at it. Is there any, yeah, Martha?
I know you said this was, the left-hand navigation is pulling in from Mickey's site because
Yeah.
it's resident on that?
Yeah.
What will that look like? Will there be, the links, will that pull from the main page that's on Family for Care right now? Or will it be Will there be anything on
Well, it's funny you asked that because Martha and Stephanie can work together on making it look good.
I didn't know if it was automated and that once it's off, like you said, then it starts to pull from a different place.
Well, it can have that same look. It's sort of what you want it to
You
be.
want consistency to some degree, but.
So
And so-
something that could go off to the side.
Yeah, so I would say, you know, on that, if people have thoughts, Stephanie and Martha are just masters at making stuff look good. This is all substance. First, making sure we have the right substance up there, and then going to how it looks. And if people are interested in either the substance or the looks, just let us know, and we can work on that.
Lisa.
Yeah.
Listening to Heather earlier, I was thinking maybe, and maybe the clinicians in the room could help me with this, but is there a resource for parents or somebody who shows up in an emergency room on what procedures are when you show up? I mean, it might be helpful for a parent to see what you can expect if you're bringing, I mean, I know I've walked into Yale Psych and it's.
They put you in the back room.
It's completely overwhelming.
Or the purple pod.
It's intimidating, it's scary, and I don't know if maybe some of you professionals know that if there's a resource that might lay out some of those procedures.
You know, and I think that's where we lack in the state level is that before we're at the ER, we should have a resource. We should have a social worker, a caseworker, somebody that's working with the family and the child, so that you're not you walk in and they're all like, oh, here comes another one,
yeah.
their crazy kid.
Well, you know,
and it's not.
But I'm just, even just some basic information, you know, this is what happens, you know, when you check in with a psychiatric emergency, you know, this is what you could expect, you know, what are the rules? What are they looking for?
That would be great
What are their?
for a legislative thing, because
Yeah.
if you'll see here, this came out, this is the victim's guide, and it says, what do you need to know? If you are a victim of crime, how does the process work? And this is a great thing. It tells you about contact the police, the criminal justice process. What is the trial process? It's for someone who's never been through it. And we might have
But it's very
a mental
different
health
for-
guide would be so helpful to a parent who
Right.
comes
Oh,
in and
yeah.
say,
I mean,
this
just
is
some
what you
basic
expect.
procedures, you know, this is who you're gonna talk to, this is what you can expect them to ask you, you know, this is
Yeah.
the information you're gonna need to have with you.
David, I'm thinking
you know.
Demas, KSAC,
Maybe even
John.
I mean, maybe it exists and we just need to access it, but.
One of the problems is that it depends on which hospital you go to.
Right.
That's true, but I thought
The
there
other
might
thing.
be some general guidelines.
Or even we could ask hospital specifics, because they may have something.
I mean, if you want to just go with our local
Yep.
hospitals, we could do that, but there should be some basic
And it's
information.
clearly different with a child versus an adult.
An adult,
Or
yeah.
in a geriatric situation,
Mhm.
you know what I mean?
Right.
This one?
Yeah.
That was
Those are different situations.
on social services website.
You have it on your.
And I think sometimes you have to know what to ask for too. I mean,
Yeah,
because,
clearly.
yeah, because
Clearly, you don't know
a
what to
lot of
ask
people
for.
walk in not knowing exactly what it is they're looking for too.
But do
They
we-
just know
but
there's
do
a
we tell
problem.
people exactly what you say to get a commitment?
Well, no, I mean, no, but,
Yeah,
I
you gotta be
think-
careful of
no,
that.
Right.
but I
Exactly,
think just
yeah.
a basic knowledge of the procedures might be helpful to people who
Just
are
like it is in the criminal justice, if you get arrested or you can report a crime, what's the process? What can you expect? Because it's a very scary, these processes are scary. You know, you go into the hospital with an illness, it's scary. You go into the hospital with a mental illness, it's elevated, or an addiction, it's elevated even more. And nobody knows well, people know what the process is, but there's no guide, and that might be helpful, especially for someone struggling with drug addiction.
And the other thing I think that's important too is we, as you go into these situations, you know, we all have these opinions of doctors and physicians, and we take what they say, and we don't know how to advocate. And that's a really hard thing to learn how to do. Obviously, you know, we don't know where we can push boundaries. We don't know how far we can push back, and that's I don't know how you teach that, but that's something that I think we have to get better at in our society regarding our medical care, our psychiatric care, whatever, is learning how to push back to get the type of care we deserve.
Yeah. How about 211, if we talk to 211? I think it's great to offer the 211, but, yeah, they don't,
Can be
you know
frustrating.
what I'm trying to say?
It's just so all-inclusive.
Right.
It's everything from
Recreation.
movies
Yeah.
and recreation to
Sure.
I mean, that would not be.
211, though, the reason we had it included it in the book is that was the only place, rather than Wheeler,
Right.
that
No, yeah, that's
you
our
can press
resource.
one button and a person answers right away and can get the mobile crisis out.
Yeah.
That was the only place.
Really? The only access point?
When I called, it was
Yeah.
right away.
that's
That's what I'm saying, like, and you
Go
call
ahead.
and
That's what I'm
you're
gonna talk
not
about.
really
I'm
getting
doing business.
far with it.
As good or bad as you think 211 is, it's Connecticut is one of the only states
say I'm blind.
that has it.
Maybe you
Yeah,
create
something.
your own number for mental health issues.
Well,
Another
it-
911.
When you go on to 211, you press 1, and then depending on what your need is, they direct you. So if you have if you're suffering from a mental illness or struggling with depression or you're suicidal, they direct. And there's a counselor or therapist on 24/7. And then if the child's under, or it's a child that's under 18, that's when the emergency response team is supposed to respond within 45 minutes. And I know the schools know those folks. And depending on which region in the state you are, is how good that is.
Well, perhaps it's getting lost in 211 and it needs to be taken out to its own.
So and that's DCF, that emergency response group is under, and it's connected through 211.
In my opinion, I felt the most helpful is, give the police and the juvenile officer all the resources they need, because they're the most effective, I think, in those situations at school, when you're dealing with, they know what, if we give them whatever they need to continue to do what they're doing and be as effective as they've been, I think that's the best thing you could tell parents.
Has the police department been trained in the mental health first aid? Everybody?
Not everybody, but a lot of officers have. They go to CIT
Great.
training. The goal would be to get the whole department and stuff.
Yeah.
I would say over 60%, 70% of the officers have been, especially the patrol officers and the SROs.
All right, so if I hear right, we're going to distribute the website so that people can access it. And please give Stephanie feedback and let her know what we need up there, and then we can vet it and put this together. But we've come a long way, and I really thank you for your hard work on this. Great.
I think one of the biggest challenges can be how to get the information out to the public, that this website is available. I mean, you can do it through the schools, but we're also talking about targeting, other people in the community, the elderly. How do we?
That is, that's a great.
That's coming.
Yeah. And what do we do with this?
Just shut it.
Whose is this?
It's here, it stays here, it stays in this room.
Okay.
You just have to shut
So, we do have some money in the budget, and there are a couple of options that have been brought up for things we could do with that. One of them, we wanted to get a little bit of feedback on how the distribution of the books has gone overall in the schools, and if we have enough books still, or do we need to order more books? Where are we on that?
I've got one box left, so it's about 150 booklets.
Okay.
So depending on Neil and Brian, what you want to do next year at your open house.
I really don't know how many were left after I'd have to go back to my office staff and ask how many we have. I really don't.
Are you thinking about, we were sort of thinking for next year, do 9th grade and 7th grade, do the high school again, even though they already got it last year because they're entering the high school, and 7th graders didn't get it. And then starting that, what are people's thoughts on that?
I don't think it's a bad idea.
I mean, it's very easy in terms of our open house, which is our most attended event of the year from a parent standpoint, to say it's available. I mean, I didn't push it into people's hands. It was available on the table. I would say a good majority of people take it. And, it's certainly hundreds and hundreds of copies of it were taken.
But you have 2 classes on one night, right?
We have 9th and 10th grade open house.
So we might need more than just the 9th grade, because presumably some of the sophomore parents would take it.
And our experience was very similar at the middle school. We had 2 different events in the fall, one for our grade 7 parents, one for our grade 8.
The pamphlets are made available at both events, and it was well received. I mean, most people did take a copy.
We also have a sixth grade open house coming up too,
It's coming
so
up in February.
any other booklets that we have, you can
I'm a big believer that in terms of you're welcome to a school, I'm not gonna push that as like the first material of like, welcome to Simsbury High School. Let me give you all of the, like, we have to make a different.
Certainly not, but there's
orient.
availability there. You don't have to make it a
So that's why
highlight.
I prefer, once people have had an experience, the open house to me is the widest audience by far that we hit. And so to say that's the night that we're gonna, I thought that was the most effective way. I mean, it's like 90% attendance at Simsbury High School in 9th and 10th grade, and it's probably 75 to 80% attendance in 11th and 12th grade still.
Okay. So Neil and Brian, can you guys get back to Mickey with the numbers you think you'd need for the books for those open houses?
Sure.
And then we can budget for those. They're $2 a book, right?
Yeah, and if you, you'd probably want what you took last year, right?
Yeah, I would
I mean,
expect about the same
you
amount.
had,
Well, maybe Mickey,
8
let's check
boxes.
first and
We
see
can-
what
we
we
can
have
see
left
how many we
over,
have at the
and
start.
then that'll be
Yeah.
a nice gauge.
all right.
And we were just gonna do the
Sentiment.
one grade in the middle school, right?
What's that?
7th grade, because 8th graders got it last
Yeah,
year.
you got 14 boxes, which was 1,680.
Oh, we have a lot left. I mean, that would be we only have 1,100 parents. If every single, I mean, because of multiple kids, and there's no way every single.
But we wouldn't do it unless you want to for 11th and 12th grade open house, would we? Because they already received it.
I think maybe you didn't think you had a need for it last year, and maybe you do this year. Yeah,
Okay.
I think you make it available. Yeah.
All right, so if you could get back to Mickey, how much you think you need,
Yeah.
so that we can order them.
Are there other places we need to make them available that we haven't made them available?
Do we have the pediatrician's offices?
No.
Talked about it, I don't know if we.
Yeah, no, they didn't go.
We talked about that and the dentist offices, the pediatricians are going to be.
There was someone on this board that said that they were going to do that. They were going to bring them to the,
Yeah, somebody worked in the pediatrician.
yeah, somebody worked in a
Oh.
pediatric, but I don't.
I think it was Sarah, what's her last name? Is a pediatric nurse, and she said she was going to look into
I
it.
can find her.
Yeah. She really follows through with most things, so I guess this is she.
And then the other option we can do is we could do a mailer like the Board of Ed does on their communication piece, and basically take some of the pertinent information from the website and mail it to every resident in town and say, hey, check out this website. It's another way to get out the information. It's not as expensive as we thought.
It was,
We had that, about 2,000.
somewhere. Yeah, just under $2,000, a similar mailer went out from the town. So we figured for $2,000, we could put a mailer together to mail out to every household in town and give information, one, that would advertise the link to the website, that would be an important thing, but also to show some basic information about where you would turn and have different areas, so that somebody didn't open it up and said, oh, that's for schools, I'm going to throw it away, but have information about suicide prevention, about elderly, whatever other ideas we could have to go into homes and make people aware that these support services are available.
To Karen's point, for folks that don't have computers or aren't using computers, contact information could be right on that.
Yes.
Yeah, absolutely.
Yeah, especially if you're gonna reach out to the elderly services.
I think Chris would be great at that.
Thank you, Lisa, yes.
Yeah, actually, Chris,
Yeah.
actually, Chris is a great communicator, and he could help with sort of, and so if people want to work with Chris on that.
I'll help you with it, but
Of
if
course.
there are other people here who are good at those type of things, and
Martha? Yeah.
Okay, yeah.
Including seniors is fine, but the bulk of it has to be geared towards kids, just because the funding source.
oh, okay.
All right, so we'll have to run it by Mickey to make sure we're in compliance with our
Oh,
grant.
I don't, you don't have to run it by me, but I just, it's,
Well, you should look at it anyway,
Majority
because
of
it's
it's
gonna have a
gotta be.
lot of information that you're an expert on.
I have to report back to the state.
Is it
so.
appropriate in youth programs in churches? You know, a lot of churches have youth programs.
Yeah, St. Albans took
Absolutely,
a couple
yeah.
of boxes.
It's cold. Yeah, I gave out to all the clergy copies of this and said it was available. Some did more than others. They are available there. Anyone else we need to draft here for this committee?
He knows where to find you.
Okay.
But we will be reaching out in terms of substance, because the expertise stuff. And anyone who wants to vet it. Like I'm thinking Sharon and Mark, who have expertise in the field too.
Well, to your point, I think that some people aren't hearing that this group is even together, what the mission of this group is, when we meet, the website, kinds of, things that have been done so far, things that might be coming up, whether they be guest speakers. I mean, it would be a good opportunity just to give the community an idea of, what the work that's being accomplished and how they can access appropriate resources.
Right.
I think that's great. I really do. Everybody needs to know that this group is working on all this. And so we would be a contact for them too.
Yeah.
Yes.
They could call and say, I don't know what to do or where to go, but I had an idea and I just wanted to share it with you, if this is something like that. But I think that it's time to kind of go live, if you will, and put it out there that we are.
Now, we do have a little timeline. We do have to spend our money by June 30th?
Yeah, preferably before.
Preferably
like
before.
June 1st.
Like June 1st. Okay, so June 1st is our deadline on, and the books need to be ordered by June 1st too?
Yeah.
June 1st, and so we need a product ready to go by June 1st. Everybody comfortable with these as priorities for this committee?
Or maybe at the next meeting, we'll have, maybe a preview of the flyer we could, as a committee, look at. No rush.
It's in April, it's April, it's April.
Right, I know. If you could have it by. All right. Under new business, I know one item coming up, so let me call on him first. Ed, you had a...
Yes, thank you, Woody. The North Central Regional Mental Health Board is looking for information with regard to problems people are experiencing with 211 and with DSS. The board has received a number of complaints with regard to 211 and the accessibility of 211. And DSS, we all know, is just a different problem. So what we're requesting folks to do is that we have a service response and access feedback form that we are asking not only consumers but also families and professionals to complete and return back to the board. We will then take that information that we receive, and then we will be going not only to the legislative folks but also to the commissioner at DEMIS to see if there's some way that we can correct a lot of the issues that we're seeing that are coming to us. So if you all don't mind, I do have the copies of the survey. If you would like, certainly please fill them out and to return them to the Mental Health Board, which is address is on the last page. I think our timeline with regard to this is going to be over the next couple months anyway, that we're going to try to get all these surveys and information back so that we can distribute it to those folks that could potentially do something about the issues that are being raised. So thank you for your assistance with that.
So is this something that you just want this committee to fill out, or do we take it home and make copies of it and give it out?
We're doing a widespread distribution of this, not only to family members, but also to anybody who could potentially access either DSS or the 211 system.
Ed, I just wanted to add that I already filled this out because I think it was emailed to me. And my biggest comment was that they should never have lumped 211 with DSS. DSS is
It's a whole different animal.
huge problem that I'm hoping the legislature is going to to address. It's just
You know,
very
it
different.
initially started out with just a 2-on-1, but then it just grew into this, and I agree that they are two separate issues, but.
Did everybody get one?
Thanks, sir.
Is there other new business anybody would like to bring up? If not, I'll make a motion for adjournment.
So moved.
I just like to extend our tremendous amount of gratitude for everything that you've done. We will miss you.
Thank you. I'm not far. Well, you know what, I'm always here for you. And you know where my heart is on this committee, so I'll be,
You have to do it as a PDF.
you know, and Cheryl and Chris know where to find me. Woody certainly knows where to find me. Actually, you all know where to find me, so. And I hope you will stop by and visit a lot, because this is, you guys have my heart, and thank you for all your efforts.
Thank you for yours.
Thank you.
I'll take that as a second for adjournment. All in favor, say aye.
Aye.
Meeting is adjourned.
Oh, no, I just was putting things back up in the place.
Yeah.
Do you see this to me?